Hi, my name is Donna. Thank you so much for joining me today. I am going to talk about nurses getting paid to work from home. And if you are a nurse and you're wondering, is it possible? You want to know more information about it? I'm going to answer the top 3 questions that nurses have about having a work from home position. But stay till the end of the video. I'm going to talk to you first about my journey and give you some insight on how to get a work from home position. This whole subject is it's a whole new world. It's very new. A lot of nurses don't know about it. There's not a lot of information. You have to spend a lot of time researching. So I have been researching, got a lot of information together, and I'm going to share what I've learned with you. And if it can help you, that would be wonderful. I actually decided right out of high school that I was going to go into nursing. And I really love the idea of helping people. And as you all know, nursing school is rough. And then when you finish nursing school and you start working, you have a big wake-up call. You want to help people, but you find out that there's not enough staff. You're running up and down hallways. You're trying to take care of your patients, but there's a lot of stress involved with nursing. And to be honest with you, because I'm going to be totally honest with you, there were times that I regretted going to nursing school because of the fact that the job itself in the traditional setting is so demanding. And when I was doing nursing in a hospital setting doing bedside care, I could not even do for myself what I was telling my patients to do. I'm telling them, oh, take your medicines on time. Oh, you need to exercise. Oh, you need to stop stressing. But the work that I was doing did not allow me to take care of myself right. I knew I wasn't eating right. I knew I wasn't taking enough time with my children when they were little. But I kept going. It seemed like, okay, well, there's no other way for a nurse. And I'm sure a lot of you are feeling that right now. You're like, well, is this the best it's going to get for a nurse? I mean, you have invested a lot of time, money, went through a lot to become a nurse. But as you've seen in the studies, there's so many nurses that are walking away from nursing or threatening to walk away or just voicing that they're just tired of it. And so what I did was, I'm like, I gotta start looking for another option. Let me move this phone. I do not want it to keep clicking and alarming. But what I was saying was that even though it was taking its toll on me, I kept going with it. And then one day I came to work and I wasn't feeling well. And I came to work anyway, and I ended up passing out, woke up in the ER, and I had hit my head. I had to get stitches. And at that time, my youngest daughter was probably 5 months old, 5 or 6 months old. And my family brought her up there to see me, and this makes me kind of emotional even talk about it. When I saw her, I was thinking, I can't keep going like this because I gotta be around to take care of my baby. And it really touched me very firmly in my heart that I was gonna have to find another way. And even during that ER visit, the doctor asked me, he's like, did you not feel well when you came to work? I say, that's correct, I didn't feel well. And he's like, well, why'd you come? And I looked at him and really wanted to ask him, don't you know why I came? Because they push us to come. I mean, they push us to keep going. It doesn't matter what you feel like. And that is the problem. And I'm sure many of you are experiencing that you practically have to put yourself and everything, all your needs on the back burner to do this nursing job in a traditional setting. And so I just made up my mind, that's it. I'm not going to do the traditional role anymore. And I started looking, and I found home health. And some of you may be in home health. It's better, but there's still a lot of challenges even with home health. And so I did home health for about 10 years, and I enjoyed the freedom, of making your own schedule, going in and out. But it got tiring. And so again, I was like, okay, I'm gonna look for something. There's got to be something better. It's got to be another way for a nurse to make a good living and not have all the burdensome task attached to it. And so I ran across case management, and I'm like, wow, this looks kind of interesting. I'm sure some of you've seen case managers and you don't really know what a case manager does. So I applied for a case management position, and I did get the position. And as you probably have seen, case managers don't do patient care. When I first started that position, I'm like, this doesn't even feel right to be getting paid as a nurse, and I'm not doing anything hands-on with a patient at all. And I really enjoyed the role quite a bit. I got a chance for the first time in my nursing career to really take care of myself and my family like I needed to, and just really relax a little bit. And so I did case management for about 6 years in a hospital setting, and then I said, okay, I keep hearing about nurses working from home, and I think I would like to do that now. I'm enjoying this part of it, but hey, I would love to just get up and have time to meditate and pray and exercise and not have to drive to work. And so I went ahead and started applying for, they call it remote nursing, virtual nursing, telemedicine, telehealth. So it's a lot of different terms. But anyway, I applied for these positions, and I did that for about a year. And I didn't get any calls at all. And so I'm like, what's wrong? And I started to give up. And I said, well, let me try some more. So I started trying again for positions. And I ran into a recruiter, and he explained to me that virtual nursing world is totally different than what we as nurses are used to. We're used to applying for a job at a hospital or a clinic somewhere, speaking to one person, they call you right away because they need people. That's not how it is. So he explained that the first thing is my resume had to be ATS friendly, and I'm not going to go into that right now. And so I redid my resume. He explained the process. I redid it, did some more research, and then I started getting calls. And it is a process involved. I'm not going to go into that full process, but what I am telling you is that I did go through the process of all the things that I learned. I had a job offer. I didn't really like that offer, so I passed on that position, and now I'm in the, fourth step of the process for the position that I really want, and it's a care manager's position. And it is a process. That's one of the things that I had to learn. It is a process. It is worth it because as a nurse, you get to use your knowledge and your experience. It's not hands-on with patient care. It's helping patients and families in a whole different way. And so I want to keep you up to date. I'm going to be posting other videos and tell you how it's going. And I want to leave you today with 3 things that nurses usually ask about work from home positions. And the first one is, who are these positions for? They want to know, is it for RNs or is it for LVNs? Guys, it's for RNs, and there are LVN positions. Now, you do have to have at least 2 to 3 years of experience as a nurse, but it's available for RNs and LVNs. And the second question that a lot of nurses ask is, what about the pay? Is the pay lower than that a nurse would average in a traditional setting? And so, surprisingly, the pay is the same as you would if you worked in a hospital or a clinic. And then there are a lot of positions that are actually higher. And I was pleasantly surprised to find that out. The third question that nurses ask is, how many jobs are out there? This one is going to surprise you too. There are so many work at home nurse positions, and they're being posted daily. And I'm going to, on some more videos, I'm going to be posting the how, the what do you need to do, way more information. And guys, again, this information is not easy to find. There's no one's hardly talking about it. I don't know if they don't know or if people are just quiet once they get it. But I had to do months of research, and I said I'm going to share this information. I'm also going to do a course on exactly how to get that job, how to get that work from home opportunity if you're interested. And so if you want to be kept up to date, you can click the subscribe button. If this video helped you, if you would click the like button. And again, I'm going to be sharing my journey with you and let you know exactly what I did step by step, so that if you yourself are like, I need to know more, maybe this is something for me, then keep watching, because I'm going to tell you step by step. I'm not going to leave anything out. It's a lot of little pieces to it, but you can do it. I'm just waiting, going through the process for my job offer. If for some reason I don't get this one now, I know the process, I can get another one. And again, I'll share that with you. Thank you guys. I'll see you soon.